Well, today I do want to talk about cystic fibrosis and muscular dystrophy. We are ramping up on them now. Things are coming together. We actually have some kids who are going to be poster children for our muscular dystrophy events coming up next year in a couple of months. So we're actually going to have our own telethon here. We've invited Jerry Lewis to be our celebrity head. And so we'll hope and pray that he does make it, but we're inviting him. This is going to be very, very exciting. We have so much good news for muscular dystrophy and cystic fibrosis kids. And this is all, today's talk about this, I'm just sort of blibbering here, but it's all due to a big article that was in the Globe and Mail, which is a wonderful newspaper. It's kind of like the USA Today here in Canada. And the title is The Consequence of Gene Testing. People with potentially fatal diseases may not necessarily show symptoms, leaving doctors to wonder what's going on here. When they show a genetic test positive for the disease and they never get the disease, what's going on? Well, of course, it depends on where they live, what they're deficient in, if they're supplementing, because there's no genetically transmitted disease. That's pretty scary to say, but that's true. At any rate, let's look at this here. I picked out a paragraph of this article, which is like 2/3 of a page of the newspaper. In the front section, it says, some other genetic conditions for which doctors are monitoring patients and waiting with cystic fibrosis. In other words, people who have the genetic markers, quote unquote, for cystic fibrosis. Remember, it's not genetic, but they call them a genetic markers, a positive sweat test, and a positive A722ZZZL6 gene, which is all a bunch of nonsense, of course. They just blibber. They say that's what they call them, patients in waiting, because they have what they consider the markers, but they never get the disease. So they're patients in waiting. Some other genetic conditions for which doctors are monitoring CF patients in waiting include hypertrophic cardiomyopathy heart attack, which is caused by the same thing that causes cystic fibrosis, a selenium deficiency. And we're able to certainly prevent that. It causes sudden death in young people and athletes. Simple deficiency of selenium deficiency, as is cystic fibrosis. And then one of the leading causes of sudden death in young people, and here comes Pompe disease. I don't know how many of you have ever heard of Pompe disease, but it's a variation on muscular dystrophy. And of course, when I went to China and did 1,700 autopsies on kids under the age of 10 who died of cardiomyopathy heart disease called Kishan disease in China to see if they had cystic fibrosis. I mean, it's a perfect thing because everybody knows that Kishan disease is caused by a selenium deficiency. And if I was correct, there had to be a percentage of kids with Kishan disease, a.k.a. cardiomyopathy heart disease. A certain percentage would have to have cystic fibrosis. It turns out that 35% out of the 1,700, 595 had cystic fibrosis of the pancreas liver as well as the cardiomyopathy heart disease. And here it comes. 100% had muscular dystrophy too. Okay, this is published. Okay, published in 1990. In an American trace mineral research journal, and also in the Chinese medical journals in 2 different languages. No doubt it was done. No doubt the results are correct. This was passed on to the Muscular Dystrophy Foundation, the same people who fired Jerry Lewis for asking him to look at my data. It was passed on to the Cystic Fibrosis Foundation. And guess what? No response. They just don't care. And so that's why we're going to the public. We're going to have our first telethon in a couple of months. I'll keep you informed as we get closer to that. We've actually picked now, we have some poster children, 3 to 5 years old, who are in fact severely disabled with muscular dystrophy. And we have kids who are now, gosh, they got to be 4 years old, who had cystic fibrosis, who we reversed the genetic markers in blind study because the hospitals that were kept testing them every month were kind of shocked when after 3 months of positive tests, they went negative. Why did that happen? Well, they didn't know we were giving them the Wallach protocol. Okay, so we're very, very excited about this. And, of course, this is all going to be sort of the core basis of this new book coming out, Epigenetics, the death of the genetic theory of disease transmission. The death of the genetic theory of disease transmission. It took 5,000 years to get rid of the theory that diseases were caused by evil spirits. If you burnt enough goats to the good gods, they would prevent the bad gods from giving you disease, right? It took 5,000 years to get rid of that theory. Well, guess what? It's only going to take 200 years to get rid of the genetic theory here. So hold your hats, folks, because we are steaming on this one. In the meantime, get a hold of that book, Rare Earths Forbidden Cures. Get a hold of the book, Dead Doctors Don't Lie. That's the only time they won't. I really should change the title to Only Dead Doctors Don't Lie. And then, of course, you're going to be looking any day now for announcements on the book, epigenetics, the death of the genetic theory of disease transmission. I am so excited about this. I have not been this excited since I discovered the cause, prevention, and cure of cystic fibrosis back in 1977, because I can see there's such overwhelming evidence here. Now this book is coming out, and it's going to be one of those things that are so exciting. We'll be able to eliminate this disease that has afflicted kids that we know of. Certainly it's afflicted them all the time, but since we know of diagnosis since the turn of the 20th century, and guess what? It's been about 110 years. Well, before 200 years is up, it's all going to end. These kids will be safe now, and you're going to be part of it. I just will let you know about this wonderful telethon coming up. Again, we've invited Jerry Lewis. We know it's going to be up in Stockton, California. And so look for it. We want 1 million people there. If everybody just gives us $2 a piece, we'll be able to get everything out, and every kid will be saved. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a bit about the flu vaccine, as I've got a story that I got from Fawkes News where the headline is, Mother Claims Flu Shot is Responsible for Death of Teenage Son. And say Charles Webb received a shot on October 15th, and then he got during a routine physical. He went on, he was doing this because he was getting ready to go on a mission for the Church of Jesus Christ Latter-day Saints. And the day after, Chandler became extremely ill, suffering from vomiting and headaches. A little more than a week later, he slipped into a coma, spent nearly a month on life support at Intermountain Medical Center in Utah. And while at the hospital, Chandler underwent a variety of tests. Doctors could not confirm what caused the illness. He was eventually taken off life support and died. His mother, Lori Webb, said that his direct cause of death was the swelling, something she believed, brain swelling that is, that she believed was the result of an adverse reaction to the influenza vaccination. So what attacked his brain happened so quickly, within 15 hours, she said, that from one CT to the scan to the next, there was so much pressure and swelling on the brain that it crushed his brain stem. According to a report from Salt Lake Tribune, they say Webb has been declined in autopsy. She believes that a pending brain biopsy that is, will reveal Chandler's cause of death. A spokesperson from Intermountain says they were legally prohibited from speaking about the case. Tom Hudichako is the spokesman for the Utah Department of Health, saying that the agency is aware of the death, can't verify whether or not it was caused by the flu shot. Department has no record of any Utah residents ever dying from the flu shot or reactions, and it says, goes on to say these kind of reactions are incredibly rare. See, like many other medical procedures, there can be side effects and adverse reactions. The vast majority of those cases, the side effects are not very severe. Soreness at the injection site, low fever, achiness. Occasionally, yes, there are more severe side effects from receiving the vaccine. Before getting the shot, according to Webb, he was a very healthy kid and had a very positive outlook on life. She isn't trying to discourage others from getting the flu shot, just hopes that people will educate themselves about the possible side effects. I mean, just what a tragic case here. And, there's been some problems about vaccines in the past, and people believe it gives them all kinds of diseases and things. Do you think, in your opinion, Doc, that this possibly could be linked to the death?
Oh, absolutely. I don't know what the percentage is, but there is a small percentage of people who react to the media that the vaccine was produced on. In other words, if you have a deathly allergy to eggs and the virus is grown in an egg, and they didn't clean it up real good before they packaged the vaccination, there's traces of egg protein in there, and you get that in vaccination, you can have a severe reaction to it. And you don't get autism and things like that from vaccinations, but you can. There's a percentage of people who will get catastrophic death as a result of vaccinations. Vaccinations, to me, are useful when you have a plague and people are dying at the rate of 10, 20,000 a day. You're safer percentage-wise to get the vaccination because maybe it might protect 25% of the people. But it seems like the medical system's really hard on those Mormons. There was a guy who's 11 years old who was diagnosed with Crohn's disease. They took his intestines out, and he was dead by the time he was 21 from complications of his treatments. In the old days, they just chased these guys out of town on a rail, tar and feather them. Got to be consequences for this kind of stuff. Quit them lip flapping and get to work here. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to California. And Cheryl, you're on with Dr. Wallach.
Oh, Cheryl, you're on the air.
Hello, Dr. Wallach. Good afternoon. How are you?
Okay, how can I help you?
I have a friend who yesterday he said he felt as though he was coming down with something. He had a fever. And then whenever he went to the bathroom to urinate, he was getting a pain in his lower abdomen. He said sometimes it was across the whole abdomen, sometimes it was in the middle. So he was wondering what you can do to help him.
Well, it depends on what that is. I mean, is this the first time he's ever suffered that sort of thing?
I think so, yeah.
Okay. Does he have any complaints historically about skin problems? Any dry skin, eczema, dermatitis, psoriasis, or any asthma, bronchitis?
Not as far as I know, but he does drink heavily.
Sure. Okay. And so this could be anything. Could be a gas bubble. You know, it's going to be a one-time deal for a while because he had a gas pain. It could be that he's got a kidney stone. You know, if it's long-lasting, it could mean he's slightly constipated. And as you're pressed down to urinate, maybe he's got an enlarged prostate, and as he's pressing down to urinate and get beyond that enlarged prostate, he's squeezing the bladder full of urine. I mean, there's all kinds of possibilities. It wouldn't hurt for him to get a non-invasive, high-resolution ultrasound. There's no invasion, no injections, no radiation. And so that's what I would do, is I had to have him get an ultrasound of his belly and his pelvis so he can see if there's anything going on in there, like gas bubbles or constipation or kidney stones, bladder stones, and so on. So that would be something. But it wouldn't hurt for him to get on a gluten-free diet, no wheat, barley, rye, and oats. We need to know if his brothers and sisters have any health problems, that kind of thing. And in the meantime, it never hurts. So what does this guy weigh?
250.
250. Well, it never hurts to take, a guy like him, I'd have him take 2 Healthy Start packs per month as just sort of a basic start, and then have him get a high-resolution ultrasound of his belly and his pelvis and do some blood tests and give us a call back, okay?
Thank you very much.
You're very welcome. All right. And, of course, these are sort of things, when you have symptoms, you haven't been seeing a guy, and you do want to get some information before you start, even considering diagnoses, because there's so many variables and so many possibilities and options. And so what you want to do when people have a discomfort or a symptom, it never hurts to take the 90 essential nutrients. Okay, it's always a good thing to make sure they get their 90 essential nutrients. And then if it's something only had once, well, if they have it again, then it's time to get some serious diagnostics. If it only happens once in 50 years, maybe gas pain. Maybe went out and had some bad popcorn at a movie theater last night. Anything's possible. Okay, well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Rockville, Maryland. And Vivian, you're on with Dr. Wallach.
Hello, Vivian, you're on the air.
Hello, Dr. Wallach. Thank you for taking my call.
Yes, ma'am.
I'm an MG patient that's taking mycophenolate and prednisone.
Okay, I missed that. I'm sorry. Stop. You say you're what kind of patient? I missed that.
MG.
MG. What is MG?
Gravis.
Oh, myasthenia gravis. Okay. To me, an MG is a little sports car. Okay. Myasthenia gravis. I gotcha.
Yeah.
Okay. And how long have you been diagnosed with myasthenia gravis?
Since 1984, but what I was calling about is because I was diagnosed with colon cancer on the 2nd of August.
Okay.
And they did surgery, and they said I needed to take the chemotherapy, but I elected not to take it.
Okay.
And I had asked them about taking some antioxidants, and they indicated that I couldn't take that because of the MG, because it would negate what the medicines was doing, because my immune system needed to be suppressed, and that would cause the antibiotics to go back up, and I may go into another myasthenic crisis. So I wanted to know what you had.
Okay, sure. Well, what do you weigh?
As of yesterday, when they told me my markers were going up, I was weighing 150.5.
150, okay. All right. Do you have any other issues I need to know about? Do you have any problems like skin problems, any eczema, dermatitis, psoriasis?
Well, I've been asking them about. I have a lot of look like moles growing out of my skin. I have been started losing some pigmentation in the skin. So it's a number of things that's been going on with my skin. But the doctor that I was seeing before didn't seem to have a concern about it.
Okay. Do you have white or gray hair?
I have gray hair just around the temples, which came about in 2005 after my myasthenic crisis.
Okay. All right. Well, here's what I would do. Number one, I would maximize your absorption of nutrients, and I would get on a gluten-free diet. Because you have a lack of skin pigment, you have a lack of or some hair color, this indicates that you have probably an absorption problem. I'd go with a gluten-free diet, no wheat, barley, rye, or oats. I'd give up all fried foods, no processed meats with nitrates and nitrites, no oils. Give all that stuff up. At 150 pounds, I'd have you eat 6 eggs a day, soft scrambled butter, or soft poached with soft yolks, soft boiled with soft yolks, 6 eggs a day. And stay away from statin drugs that'll lower your cholesterol. Stay away from those. And then at 150 pounds, I'd have 2 of the Healthy Heart and Brain packs per month. Take a full dose of everything twice a day. And then call me every 2 weeks. I want to know how your symptoms are doing, Vivian. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Southern California. And Vadim, you're on with Dr. Wallach.
Vadim, you're on the air.
Yeah, Dr. Wallach, thank you for taking my call. I just came from Ukraine visiting my parents, and I shared my excitement about your products, about yourself, about the knowledge that you possess. And unfortunately, my fellow Ukrainians and countrymen, they are so skeptical. And what first question they asked me when I showed them video, why Dr. Wallach himself wearing glasses and losing hair if the products are so magical and helps from practically everything. And I had no answer to that, so I'm turning to you to help me to answer.
Okay, well, here's the answer. There's 2 answers. Number one, all 4 of my grandparents are Ukrainian. And that's why I look ugly like the people asking those stupid questions. That's number one. Number 2, the thing you have to appreciate is when you have malabsorption problems, you don't efficiently absorb everything, right? You're not what you eat, you are what you absorb. None of those things are genetic. You have to appreciate my eyes have improved like 80%. At one time, I needed glasses so strong you could start forest fires with them, run the sunlight through them. I could start forest fires. They were such heavy magnification. But now they're only like 1.5 magnifications. I don't even need glasses to read. You know, I can read without having glasses on. And so I've improved 1,000% to what I was. And, of course, I'll never totally get rid of glasses because I have a malformation in my eyeball because my mother was missing something during pregnancy and my eyeballs are forming. So when they get past their stupid questions and they're ready to really save themselves from heart attacks, cancer, diabetes, and arthritis, Alzheimer's disease, and stupidity, give me a call. Is that fair?
I'll do.
Okay, Vadim. Bye-bye. Okay. Yeah, I love it when I give people $1 million worth of free information, and all they want to do is ask, why are you wearing glasses? This is a very, very stupid question, okay? And that's why they fall prey to medical doctors. Medical doctors love people like this. Vadim is just a reporter here. I'm not picking on him. I'm picking on the people who ask him those questions. And I run into this quite frequently. If you're a religious person, even Jesus Christ is supposed to be the Son of God, right? Nobody believed him. So I don't feel badly that there's people who don't believe me. And so it's one of those things where I'm very, very happy to give people free information. And I don't have really time to argue with them and try and drag them across the finish line and this, that, and the other. If they're not prepared to take the information and run with it, don't beat me up. Just go die. Okay, Doug, let's have another question here.
Those people still believe the world's flat, too.
Exactly.
Let's head to Monterey, California. And, Nick, you're on with Dr. Wallach.
Thank you.
Nick.
Hello, Dr. Wallach. I have a question about fibromyalgia.
Oh, you got my name wrong there.
Did I really? I'm sorry.
Yes, it's Wallach, not Wallet.
Ah, okay. I'll try better next time. Anyway, I
wasn't
have
quite
a
sure
brother.
You did that on purpose or accidentally.
That was accidental.
Okay.
All right. I have a brother-in-law who's about 82 years old, suffering from fibromyalgia. He and his wife will be with us for Thanksgiving. We pick him up at the airport tomorrow. And if you have a program for him, I'd like to introduce him to it.
Yeah, well, how old is he? He says he's 80-something?
82.
Okay, what does he weigh?
He's very slight now. He probably weighs 155 or 60.
Okay. When you have fibromyalgia, what I would do is I'd put him on a gluten-free diet, no wheat, butter, rye, and oats.
Okay.
I would actually get rid of all the fried foods, the processed meats, and oils out of his life. And 150 pounds and 82 years old, I'd put him on one Healthy Start pack per month. I'd also get him our selenium. I'd give him 2 of those twice a day. It's a little bit underdosing, but he's 82 years old, so let's start light.
Okay.
And I would also give him one other thing, something to deal with if he has muscle pain or joint pain. He could use our CM cream topically on top of his joints and any muscles, tendons, or ligaments, or his back where he might have some pain. And so that will cover the waterfront of all the things he's going to require to support and promote maintenance repair of his body, his connective tissue, his muscles. But it's also going to give him some pain relief, which when people are uncomfortable, no matter what the theory is, they're just going to be uncomfortable. So we want to make sure he's comfortable. Nobody needs to suffer. I don't like people of any age, let alone people 82 years old, taking oral painkillers, even NSAIDs, ones that are non-narcotic painkillers like aspirin and bufferin and that kind of stuff. I don't like those things for these older people. So I like topical stuff like our CM cream. Has nothing bad in it, all good. Okay, Doug, let's go to callers.
Let's head to North Carolina. And Greg, you're on with Dr. Wallach.
Well, Greg, you're on the air.
Hey, how are you doing, Doc?
Well, I'm doing fine. How are you doing, Greg?
Outstanding. Hey, I've got an individual who think they may have rheumatoid arthritis, never been diagnosed with it, but have a stiff joint. It's actually their knee. Whenever we can, several hours afterwards, the pain goes away, but the joint itself it's still stiff,
swollen. Sure.
And
okay. Well, here's the deal. Anytime somebody has joint problems, or swelling, stiffness, pain, inflammation, redness, swelling, what I like to do is get them on one healthy bone and joint pack per 100 pounds of body weight. One healthy bone and joint pack per 100 pounds of body weight. And then you can use the CM cream on those knees and reduce the swelling and pain. Use it lavishly all over the knee, and they can apply it 2-3 times. And if they weigh 200 pounds, they're going to get 2 of those jars of CM cream. They're going to be able to take 15 glucogel a day, which is designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And just on the chance that they do have rheumatoid arthritis, I would throw in our killer biotic. Have them take 3 of those twice a day per 100 pounds of body weight. Be a little heavy with it. And it'll be 2 bottles a month per 100 pounds of body weight. And it has a blend of 8 herbs, which actually support the immune system. And 2 of those 8 herbs actually have antimicrobial activity. And that's important because rheumatoid arthritis is not autoimmune. It's not genetic. It is, in fact, a disease of infection. Mycoplasma, mycoplasma. That bug actually is a respiratory bug, but when it gets into your bloodstream, it sets up housekeeping in the joints and causes what is referred to as rheumatoid arthritis. It gives you a positive RA factor. And rheumatoid arthritis, if you want to use antibiotics, you can kill the bug in 2 weeks, just like you can kill syphilis bacteria in 2 weeks with penicillin. You can kill sore throats and pneumonia in a couple of days with penicillin or other antibiotics. Well, the mycoplasma that causes rheumatoid arthritis, you can kill that in 2 weeks with this minocycline, which is a member of the tetracycline family, and take the healthy bone and joint pack, 1 per 100 pounds of body weight, to give the body the raw materials to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And miracles happen. It's amazing what happens here. Their choices, of course, they can go get all these drugs, including Enbrel and all these IV drips, for $40,000 a month. But insurance pays, who cares, right? And then there's joint replacement surgeries. Well, who cares? Insurance pays. So, everybody has their choices. I prefer the nutrient approach and the herbal approach. And so let me know what your friend thinks, Greg. We'll be happy to work with you guys. Be back after these messages. How can I help you?
I have a friend of mine. She's 36 years old. She has she has multiple sclerosis. She's not very healthy. She had an MI with her second child, then she had a third child after that has some deficits I can tell is nutritional. But recently, she was going to Sabri. They took her off of that. She's barely walking at this point. She's having a lot of chest pain, rapid heart rate. And when I looked at her MRI, she's got lesions all through her T-spine. It's awful. Like, it's they're huge. I can't believe that she's even functioning. So her autonomic nervous system is way up. Her heart rate, as soon as she gets up and walks, is in the 200s, and they're not actually controlling her heart rate.
Okay, wait a minute. Stop. Stop. Okay, you're going through too much too fast here. I need to ask a question about it. You said when she gets up, her heart rate is 200. What is her heart rate when she's laying down?
When she's resting, she's about 110.
Okay, so it almost doubles when she stands up.
Yeah.
Okay, now this could be another problem. I mean, there's no rule that says she can't have 18 problems at the same time, right? So that may or may not be directly related to the MS. And let's see here. What does she weigh again?
She weighs about 180.
180, okay. How tall is she?
5'7".
Okay. Yeah, I'd like to see her weigh 160, kind of thing for a lady. So she needs to lose 20 pounds. I want her to be on a gluten-free diet. No wheat, barley, rye, or oats. No processed meats with nitrates and nitrites. No oils, no margarines, mayonnaise, salad dressing, and cooking oils. Absolutely no gluten, no wheat, barley, rye, and oats. I want her to have 180 pounds. I want her to have 8 to 10 eggs a day. 8 to 10 eggs a day. They have to be soft, scrambled in butter, not oils or margarines. They can be soft poached with soft yolks, soft boiled with soft yolks. Then I want her to have 2 healthy heart and brain packs per month. 2 healthy heart and brain packs per month. I want her to have, let's see here, I want her to have the Ultimate Daily tablets. I want her to have 3 of those twice a day as 1 bottle a month. I want her to also have the Smart FX, 3 of those twice a day. That's 2 bottles a month. That's to make neurotransmitters. And then, of course, she's going to, in the 2 healthy heart and brain packs per month, she's going to get 2 bottles of selenium, so she can have 3 of those twice a day. And that's where we want to go. Let's start out there. Okay?
Sounds awesome. Thank you so much.
Give me a call every couple of weeks. Let me know how this lady's doing, okay?
That sounds wonderful.
Okay, Renee. You bet. Okay, we only have a moment left here, and I'm going to go ahead and take it. And basically, when you have MS, and of course the fastest age group growing today with MS are kids under the age of 12. They're even diagnosing MS in kids under the age of 2 years old now because it has to do with all these bad things people are eating, all this oil and fried foods and processed meats is like crazy. The margarines, nobody's eating eggs. The part of the brain that's damaged when you have MS is the myelin, the insulation material of the brain, and it makes up 75% of your brain weight, and it's actually 100% cholesterol. And so people need to also get off statin drugs. Anything that's going to lower cholesterol, they got to get off of. They cannot be eating egg beaters. They got to eat real whole eggs. And this is very, very important here. We are killing ourselves following the doctor's directions. And so I want everybody to kind of reevaluate what you're doing. And if your doctor didn't email you or call you February 2012, when they got the notice from the FDA that drugs that lower cholesterol, statin drugs, actually contribute to brain diseases like dementias, Alzheimer's disease, and MS, and Lou Gehrig's disease, Parkinson's disease, get off your statin drugs. Get off your statin drugs and take your eggs instead. And, of course, these things will get significantly better as long as you're taking the 90 essential nutrients with it. Okay? We have to take care of ourselves. The medical system has screwed us up. It's not greedy CEOs. It's the medical system. When do people get it? Okay? Well, we'll be back another day. Thank you so much, everybody. Thank you, Shar, for being here, standing by, and making sure you're feeding me all this information. Thank you, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.